With us in the studio, Dr. Russ Canfield. He is a conventionally and holistically trained MD. Russ is board certified and has been practicing family medicine since 1999. He's a certified diabetes educator, board certified in integrative holistic medicine, and he is an artist and a scientist. I'm your host, Alan Hutner, who along with Russ here will try to simplify and make easy through our conversation some very complex subjects that you, over the many years of study and experience as a medical doctor, have come to know.
Yeah, let's have fun.
Have some fun.
Let's have fun. Let's talk about 360 medicine, and we can have a series of discussions about different aspects of integrative health and wellness, and I look forward to it.
Okay, so let's begin with 360 medicine. I mean, that's your personal creation. It's
Yeah, so I worked for several years as an employee in different arenas. I worked in the Indian Health Service in a public health kind of format, and worked as an employee in an integrative medicine practice in Albuquerque for several years. But just about 4.5 years ago, in 2006, I started my own solo integrative medicine practice and decided to call it 360 Medicine.
this idea of a holistic healing center from the very beginning. You had this sense that you wanted to practice in a different way than, let's say, more conventional medical doctors might practice.
This is true. This is true. I think that conventional allopathic MDs have part of the truth. And I think I felt very early on in my medical education that the naturopathic approach, or the Oriental medicine approach, or the chiropractic approaches were all valid, and felt that it was important to make room.
In front of me, one of the bulleted items, we believe in challenging the status quo in everything we do. You want to pick up on that and kind of do a little explanation of challenging the status quo? What if status quo works? I mean, yeah.
Well, I think that oftentimes, it works to some degree. It works in some circumstances, and not so well in others.
I think before we cover the welcome statements here, we need to go to, we have one major rule.
So, one major rule that we have is that we include everything that works. That every healthcare provider has some important piece of the truth, something to contribute, and I feel that part of the kind of ethic of 360 medicine is to honor and cherish and include in a more spacious embrace many different healthcare paradigms, and be able to kind of coach people, help people navigate this kind of more expansive territory.
I like that. I mean, that you believe in challenging the status quo in everything you do. So that even says something can work at a certain level, but might be improved. So you're open to
constantly being improved.
Constantly be improved.
Right.
What about thinking differently? You mentioned here we believe in thinking differently.
Thinking about underlying causes of dis-ease in the body, as opposed to just pharmaceutical solutions to treat decreasing and controlling symptoms.
Mm-hmm.
But often the causes are not just one or two. A lot of times the solutions to chronic conditions are more multifaceted, and sometimes the short path to healing is actually a little bit more complex and a little bit more multidimensional.
Mm-hmm. Speak about what you integrate into your model that works.
Well, we use a fair amount of nutrients and antioxidants and herbs, and sometimes we'll give some of these nutrients intravenously. I definitely prescribe. I definitely find that in difficult situations or more severe situations that pharmaceuticals are extremely handy to have around.
Quick acting.
Yeah, quick acting.
Very powerful.
Powerful. Sometimes require a little bit of detoxification the more that you use them. And we're very individualized, I think, in the treatment plans that we create. And I tend to resist cookbook medicine, right? Where, you're a chemist and for a particular condition, to treat a particular condition, you give this, this, and this, and you do that in a rote kind of a way. I tend to feel that it's very important to individualize your approaches and kind of get a sense of what may be more important in a particular individual that has a condition. But that happens a lot in designing a medical treatment plan that may not always be a food allergy that you're trying to avoid, but certain preferences come up, or you get a sense of what's worked in the past to try to start formulating something in a more elegant way than a cookbook.
All right, let's go to the integral health model.
So I try to be able to take the biggest picture. I consider myself, Alan, as a generalist. I'm a family physician. I'm a primary care physician, not a specialist that just looks at x-rays all day. I'm not a somebody that just specializes in the foot. I kind of like to understand the whole person, the family context, and my goal is to be able to see the big picture. And I feel that as a physician, as an MD, and having some knowledge about conventional medicine, as well as integrative approaches, that I can help to coach people with a more sophisticated eye. So, I might say that the individual person has health behaviors, or, are you choosing the broccoli, or are you, having some, a bagel that's a little glutinous and not particularly colorful.
So what's coming to mind is the coach model here,
Yeah.
Which is very popular. There are coaches all over the place for different things. Why not? The doctor is a coach.